According to the 2025 update from the American Heart Association in 2022, alone 941,652 Americans lost their lives to cardiovascular disease. That means nearly 2,600 families every single day lose a loved one due to a failing heart. Every 40 seconds, someone in the United States suffers a heart attack, and this number continues to climb. Even more alarming, 1 in 5 heart attacks is silent, meaning there's no chest pain or classic warning signs. These often occur in adults over 60, especially senior women, where symptoms like shortness of breath, fatigue, nausea, or numbness in the left arm are easily mistaken for arthritis, the flu, or low blood pressure. The same report shows that nearly 48.6% of U.S. adults are currently living with some form of cardiovascular disease, from high blood pressure to heart failure or arrhythmias. For those over the age of 60, the risk of experiencing heart attack symptoms in men or heart attack in women doubles compared to younger individuals, especially if they have a history of heart issues. At the same time, the financial burden is exploding. In the past year alone, the economic cost of heart disease in the U.S. surpassed $422.3 billion, and if no intervention is made, that figure is projected to triple to $1.8 trillion annually by 2050. The truth is, your heart won't always give you a warning. Even if you've never had heart problems before, once you're over 60, you cannot afford to ignore the warning signs of a heart attack. Now is the time to learn how to prevent a heart attack. Understand the causes of heart attack and prepare yourself with the knowledge to survive a heart attack alone, so that when the moment comes, you're not just saving your life, but possibly someone else's too. I don't think you're surprised to hear that Americans are having more heart attacks than ever. But what's truly alarming is this. Most of those heart attacks could have been prevented, not because of bad genes, not because getting older means getting weaker, but because modern lifestyle is silently pushing our hearts to the edge. Let's start with diet. You've probably heard eat less red meat, more vegetables, right? But the problem isn't just meat. Processed foods, fried snacks, sugary drinks, frozen meals, fast food, those are the real culprits. They slowly damage the lining of your arteries. Over time, cholesterol builds up. One day, blood can't reach the heart. A heart attack hits, no warning. Then there's physical activity. After 60, I know you're not doing push-ups or running miles like before. But if you sit around all day, your heart isn't doing its job either. Just 15 minutes of walking each morning can cut heart attack risk by up to 40%. Not much, just consistency. And sleep. It's the cheapest medicine most people ignore. Sleeping less than 6 hours a night raises stress hormones, blood pressure, and throws off heart rhythm. Your risk of cardiac arrest, sudden heart stoppage doubles. And sadly, many don't even know the difference between cardiac arrest versus heart attack. So they do nothing. Some patients tell me, "Doc, I just had a little chest pain, but I'm fine now." They call it a minor heart attack. But here's the truth, there's no such thing as a minor event when your heart was just blocked. That's a warning shot. And if you ignore it, the next one could be the last. You can survive a heart attack, but life after it may never be the same. I've had many patients tell me, "Doc, I just felt a little tired. I had no idea it was a heart attack." And even after they were saved, they returned home unable to do simple things, grocery shopping, climbing stairs, or even remembering when to take their meds. That's what happens when you go through minor heart attack recovery the wrong way. It's not just physical pain, it's the slow loss of independence. Medical bills. One emergency stent procedure in the U.S. can cost anywhere from $40,000 to $120,000, not including medications, follow-ups, rehab. But what troubles me most isn't the money. It's the emotional cost. Some who were once the strong pillar of the family now sit silently in the corner. Some begin to lose memory. Others sink into depression, battling insomnia for months. Younger bodies may bounce back, but a heart attack in elderly time is no longer on your side. After 60, every heart attack causes permanent damage. Weaker heart, less elastic blood vessels. Things you once did with ease may never come back. I'm not telling you this to scare you. I'm telling you so you can prepare. Because if you know how to survive a heart attack alone, if you catch the warning signs early, if you choose to live proactively, you won't just survive. You'll stay strong, you'll live longer. A heart attack isn't like a fall. There's no crack, no bleeding, no one screaming help. It comes like a shadow, quiet, subtle, but strong enough to take a life in minutes. If you've ever heard someone say, "I just felt tired and then I blacked out," chances are they experienced a silent heart attack. That's the danger. So what are the early signs of a heart attack? Some feel sharp chest pain, but it's mild. Others feel shortness of breath and think it's their lungs. Nausea, cold sweats, dizziness, all dismissed as just a bad meal. That's the mistake, thinking it will go away on its own. Heart attack. Warning signs in elderly don't always look like what you read in a textbook. In older adults, symptoms are often misread as arthritis vertigo or just emotional stress. For postmenopausal women, it's even harder to detect. They may not feel chest pain at all, only fatigue, insomnia, or soreness in the neck and shoulders. And if you live alone, ask yourself this. If a heart attack happened right now, would you know what to do? Would you know how to survive a heart attack alone? This isn't a far-off scenario. It's a real-world test, one that plays out every day in the world of senior health, where the right decision made at the right time can add 10 more years of independent living. I'm not saying you should live in fear. I'm saying be aware. Because if you learn to listen to your body, if you take early action, you can prevent heart attack naturally, without waiting for your heart to scream for help. I'm not asking you to starve yourself or run 5 miles a day. But if you truly want to know how to prevent a heart attack, here are 5 simple habits you can follow daily. No medication, no money, just commitment. 1 walk for 15 minutes each morning. You don't need to go fast. You don't need to go far, just stay consistent. Every step helps your heart pump more efficiently and your blood vessels expand naturally. This is one of the most classic senior heart health tips you'll find in every medical guide. 2. Cut your salt intake in half. You don't need to give up flavor. Just taste your food before adding more and start reading nutrition labels, because salt isn't just in the shaker. It's hiding in canned goods, sauces, and even bread. Your heart will thank you after every meal. 3. Get at least 7 hours of sleep every night. No phones in bed. No coffee after 2 p.m. Good sleep is like medicine for your heart. It lowers blood pressure, steadies your heartbeat, and allows your body to repair itself, no prescriptions needed. 4. Eat at least 1 heart-friendly food each day. Avocados, walnuts, salmon, dark leafy greens. These are the best foods for heart health recommended worldwide. Simple, affordable, no extreme dieting required. Monitor your blood pressure, heart rate, and weight at least once a week. Use a smartwatch or just stop by your local pharmacy. A small act of awareness today could save you from a medical emergency tomorrow. These are simple daily habits to reduce heart attack risk, small steps that make a big difference. You don't need to change your whole life. Just start with 1 small change a day. The heart doesn't stop without warning. It always speaks first through fatigue, restless nights, or a shortness of breath you almost ignore. The real question is, will you catch the signs in time? If you're still watching, you're no longer passive. You're taking action. And by eating better, sleeping deeper, and walking consistently, you're helping your heart grow stronger year after year. On this channel, I share many ways to prevent heart attack, lower blood pressure naturally, and practical senior health tips you can apply today. So go ahead and follow this channel. Find something here that saves your life or someone you love when it matters most.